Good morning. Today's class is on broad spectrum antibiotics. At the end of this class, you will be able to define what a broad spectrum antibiotic is and why it is called a broad spectrum antibiotic. What is the mechanism of action of the broad spectrum antibiotics? What are their uses and adverse effects and contraindications if there are any? We have under the broad spectrum antibiotics the tetracyclines, chloramphenicol, and one drug which comes under the group of glycylcyclines. Tetracyclines are called tetracyclines because in their structure they have 4 cyclical rings. The tetracyclines are classified based on the duration of action. So we have short-acting tetracyclines, duration of action is 6 to 8 hours. Under this group we have chlortetracycline, oxytetracycline and tetracycline. The intermediate acting tetracyclines are of 12 hours duration of action, where we have dimeclocycline, metacycline. These are intermediate acting. The long acting tetracyclines which act between 16 to 24 hours includes doxycycline and minocycline. So the classification of tetracyclines is based on the duration of action. Short acting, intermediate acting and long acting. Please note doxycycline and minocycline are long acting. So tetracyclines are called tetracyclines because they have 4 rings in their chemical structure. The mechanism of action of tetracyclines is they bind to the 30S ribosomal subunit of the bacteria and prevent the addition of amino acids to the growing peptide chain. Therefore, tetracyclines inhibit bacterial protein synthesis and they are bacteriostatic. The spectrum of activity of tetracyclines. Tetracyclines are broad spectrum antibiotics, meaning they are effective against gram-positive organisms, gram-negative organisms, rickettsia, chlamydia, spirochetes, mycoplasma and some protozoa like entamoeba and plasmodia. Now this table shows the preparation of the tetracycline, the route by which it is administered and if it is affected by metal ions. What is this affected by metal ions? We will describe under the pharmacokinetics. So all tetracyclines can be given by the oral route, that is tetracycline, oxytetracycline, chlortetracycline, minocycline and doxycycline. Again, note here minocycline and doxycycline, which we classified as long acting, are not affected by metal ions. So coming to the pharmacokinetics of the tetracyclines. Slow but almost complete absorption on oral administration. Tetracyclines pass into most body fluids including saliva. Tetracyclines, because of their structural nature, that is they have 4 rings, they have high affinity for calcium which is found in large quantities in growing teeth and bone. Now this is of importance in children. Tetracyclines, most of them are excreted unchanged in urine with the exception of doxycycline and minocycline which are excreted in bile. Therefore, doxycycline and minocycline are safe in patients with renal impairment. This is a 3-mark question. Give reason. Minocycline is safe in patients with renal disease. The reason is minocycline, doxycycline, these are excreted in bile. Most of the tetracyclines except doxycycline and minocycline chelate or chelate with metal ions. Therefore, it should not be administered with antacids which contain magnesium and aluminum or with milk or calcium containing drugs. This again is a 3-mark question. Give reason. Tetracycline should not be administered with milk or tetracycline should not be administered with antacids. What happens? The tetracycline chelates the heavy metal or the magnesium or calcium, absorption is reduced, therefore the bioavailability of the tetracycline is decreased. Doxycycline and minocycline, these are the advantages. They are not affected by metal ions. So what are the advantages of doxycycline and minocycline over tetracycline or oxytetracycline? One is long duration of action. Second is not affected by metal ions. And third is they are excreted in bile, therefore safe in patients with renal disease. Adverse effects and uses of tetracycline. The adverse effects are quite long with the tetracyclines. On the gastrointestinal tract, like with most drugs, nausea, vomiting, diarrhea. In addition, it can cause superinfection. The causative organism of the superinfection is Clostridium difficile, which causes pseudomembranous colitis. Because of the affinity of tetracyclines for calcium, therefore bone and teeth, if tetracycline is given to children, it can chelate the calcium in the bones and cause growth retardation. Therefore, tetracyclines are contraindicated in children. In children, tetracyclines can chelate with the calcium in the growing teeth and cause permanent yellow-brown discoloration. Therefore, tetracyclines are contraindicated in children. So there are two reasons why tetracyclines should not be administered in children. One is growth retardation and second is yellow-brown discoloration of the teeth, which is permanent. If tetracyclines are administered during pregnancy, there is a risk of the fetus developing dysgenesis of the teeth. And in some infants where tetracycline had been used, it can cause a false increase in intracranial tension, which is reported, which is called pseudotumor cerebri. Minocycline is known to cause, in addition to superinfection, also cause black discoloration of the oral mucosa, especially the palate. Tetracyclines, if administered during pregnancy, there have been cases reported of fatal acute hepatic necrosis. Therefore, tetracycline should not be used in pregnancy. So, two reasons for tetracyclines contraindicated in pregnancy. One is dysgenesis of teeth of the developing fetus, and second is acute hepatic necrosis, which could be fatal. Now, on any medicine label or box, we have seen manufacturing date and expiry. With tetracycline, the expiry date is important because if expired tetracycline is used, it decomposes to form epi and hydrotetracycline, which can damage the kidneys and cause azotemia and a Fanconi-like syndrome. Tetracyclines cause photosensitivity reactions, so that is one of the drugs which causes photosensitivity. The other drug which we mentioned much earlier was the sulfonamides. Again, experimental evidence in experimental animals suggests that tetracyclines, if administered during pregnancy in the experimental animal, causes inguinal hernia. Now coming to the uses of tetracyclines. Remember, tetracycline is a broad spectrum antibiotic. Tetracyclines are the drug of choice in rickettisial, chlamydial, mycoplasma infections, lymphogranuloma venenum, and plague. Brucellosis, second drug of choice, also useful in atypical pneumonia, relapsing fever, bacillary dysentery, traveler's diarrhea. Doxycycline is used in malaria and in adult filariasis. Doxycycline or tetracycline topical for and oral for acne vulgaris. Tetracyclines are the second-line drugs in tetanus, anthrax, actinomycosis, and listeria infections, penicillinase producing Neisseria gonorrhoeae, early and late syphilis, leptospirosis, chlamydia. In trachoma, tetracycline ointment and also per oral, chancroid, tularemia, and in intestinal amoebiasis, tetracyclines do not directly attack the entamoeba, but by altering the gut microflora, it makes the environment hostile for the enter. So the uses of tetracyclines, the list is quite long. There can be a 5-mark question, uses and adverse effects of tetracyclines. Tigecycline is a synthetic glycyl cycline. Mechanism of action and spectrum quite similar to tetracycline. In addition, it is also effective against anaerobes. Also effective against methicillin-resistant Staph aureus, vancomycin-resistant Staph aureus, and vancomycin-resistant Enterococcus faecalis. Is effective against tetracycline-resistant strains. Tigecycline is not active against Proteus and Pseudomonas. The mechanism of action is similar to tetracycline, that is, it binds to which ribosomal subunit? The 30S ribosomal subunit, inhibiting the peptide chain elongation and is bacteriostatic. Tigecycline is given slow intravenous with a large volume of distribution and a long plasma half-life. Adverse effects include nausea, vomiting, diarrhea, skin rash, photosensitivity reactions, and superinfections. Tigecycline is used in serious and hospitalized community-acquired pneumonia, complicated skin infections, serious intra-abdominal infections. Now, tigecycline is not routinely used. That is a point to be noted. Demeclocycline is used in syndrome of inappropriate antidiuretic hormone secretion, where there is unresponsiveness to the antidiuretic hormone. In a dose-dependent and reversible manner, this condition can be treated by using demeclocycline. The third broad-spectrum antibiotic is chloramphenicol. Spectrum of activity is similar to tetracyclines. So it is active against gram-positive organisms, gram-negative organisms, chlamydia, rickettsia, mycoplasma, lymphogranuloma venereum, chancroid, etc. Chloramphenicol binds the bacterial 50S ribosomal subunit near the A site and inhibits bacterial protein synthesis. Chloramphenicol is bacteriostatic. Well absorbed on oral administration, distributed to all tissues, including the CSF. So please note, chloramphenicol crosses the blood-brain barrier. Chloramphenicol is glucuronide conjugated in the liver and has a plasma half-life of about 6 hours. This glucuronide conjugation is important. Chloramphenicol by itself is very bitter. So to make it pleasant tasting, chloramphenicol palmitate as a prodrug is used. Adverse effects of chloramphenicol include aplastic anemia, which can be idiosyncratic and dose-dependent. This is one of the very dreaded adverse effects of chloramphenicol. Idiosyncratic means genetically determined, not dose-dependent, adverse event which is potentially fatal. Superinfections with Candida and Clostridium difficile. Grey baby syndrome. Now this happens if an infant is given chloramphenicol which undergoes glucuronide conjugation. Now in an infant, because of the liver function not yet fully developed, glucuronide conjugation is not happening properly. So this results in accumulation of a chloramphenicol metabolite which blocks the electron transport chain, causing respiratory depression and muscular weakness. This is called Gray baby syndrome. This is a 3-mark short note. Very rarely, anaphylaxis, angioedema and skin rash, gastrointestinal upset. Now, due to the serious adverse effects of chloramphenicol, especially aplastic anemia, the use of chloramphenicol is highly restricted. So, when does one use chloramphenicol? Typhoid fever, which is resistant to quinolones. Remember, ciprofloxacin is the first line drug for typhoid fever. Meningococcal infections in patients who are allergic to cephalosporins. antibiotics. Rickettsial infections in pregnancy and in children. Otherwise, the drug of choice for rickettsial infection is a tetracycline. Now, because tetracycline is contraindicated in children and pregnancy, then we think of using chloramphenicol. H. influenzae meningitis, let's say, if it is very serious, chloramphenicol crosses the blood-brain barrier. So, we use chloramphenicol. With this, we complete the topic of broad spectrum antibiotics. Thank you.